There's a new treatment for local glaucoma patients. Wendy Kushel gives us a look.
Glaucoma is a condition where pressure in the eye is too high for it to be healthy. If left untreated, it can cause vision loss. Now a new surgery is available in our area. The new minimally invasive eye surgery is called Trabectome. Ophthalmologist Joseph Bergmann with Aurora BayCare Medical Center just recently started performing it in our area last fall.
The trabectome is made through a very small incision, less than 2 millimeters large. It results in very quick recovery of comfort and visual rehabilitation, whereas with more traditional surgical approaches it can take several weeks to even over a month before your vision's back to baseline.
Let alone less risk of infection and bleeding compared to traditional surgery. Jerry Miller has glaucoma.
I noticed, like when I was reading or looking far off in different things, that I had a little bit of vision missing on the left eye. So I thought, you're supposed to go in once a year or, every other year. Well, I prolonged it for, like I said, 4 years. And when I went in, that's when they found that I had glaucoma.
She's now been seeing Dr. Bergmann, who's trying to find the right eye drops for her. She's on her third kind of drop. If that doesn't work, her next option may be trabectome surgery. Her advice?
I would recommend everybody, it doesn't matter your age, to go, once a year or every 2 years for a complete checkup.
As for who trabectome is right for,
the trabectome is best suited for a patient whose pressures are around the mid-20s, either on their current level of medication or on no medication. There are patients who just cannot tolerate the drops because of side effects, because of lack of efficacy. The drops and topical medications, the lasers, just aren't the appropriate choice.
And there's a cost benefit too. Trabectome is a very quick surgery, which means costs will be lower than a traditional eye surgery, and the number of expensive medications the patient is on usually gets down to just one, saving on prescription costs. To learn more about trabectome eye surgery, call Aurora BayCare at 1-866-938-0035, or you can now email them at healthwatch@aurorabaycare.com.
Thanks, Wendy. Many of us use humidifiers to help deal with this dry winter air. They can help ease dry skin and sinuses, but humidifiers can also cause problems if they're not cleaned properly. Built-up mold and fungus can be released into the air, triggering flu-like symptoms and even lung infections. To keep bacteria away, experts recommend cleaning the humidifier tank and reservoir with a disinfectant every 3 days. Change the water every day. Use distilled water to cut down on mineral deposits and replace filters regularly.